Hi, this is Dr. Alex Eson today. Uh, I really want to talk to you about two skin cancers, one being squamous cell carcinoma or cutaneous squamous cell carcinoma, the other one basal cell carcinoma. And this was recently something I was told by a patient of mine who literally told me, Dr. Eson, I cannot have another facial surgery. It's just way too much. Uh, as you well know, every time we mention skin cancer, we always think about melanoma. But realistically, basal cell carcinoma and a squamous cell carcinoma are a whole lot more common. Uh, they're often treated with surgery, but what happens is when you undergo many surgeries, especially if it affects your face, then it becomes a nuisance. And Mohs surgery, even in the hands of some of the best dermatologists and plastic surgeons, are somewhat a little difficult. Uh, Michelle, one of my recent patients, she, I guess 2 years is recent, 74-year-old female who presented to us. She basically lived on the beach and she remembered using baby oil in the sun rather than sunscreen. And her first cancer appeared next to her nose and it was successfully removed. Another one showed up next to her ear, and then in her forehead, next to her eyes. And I think over several years, she ended up having multitude of surgeries. And when I met her, she wasn't healing as fast, so I think the scars were getting to her, and her nose had been reconstructed, part of her ear had been removed, and the skin besides her eye felt tight. And so every time a new spot appeared, she just wondered, when am I going to lose my whole nose? So ultimately, what happened was the last time she was diagnosed with basal cell carcinoma, she ended up thinking about whether or not she wants to do something other than what she had done, which was the removal of the tumor that had worked in the past. And the question she had to her primary care doctor before meeting me was, is there anything preventive? I've been using some of the best, I guess, suntan lotions now, but I guess it's after the fact. And she wanted to know if radiation could be an option. And she had set up an appointment to see a radiation oncologist for her cancer. We spoke a little bit about basal cell carcinoma, and it's basically a shiny, purpley bump. Uh, Hers sometimes, the one she had bled sometimes because they would have like an open sore. They would eventually get bigger, end up like a scar tissue of some sort. And the places where she had surgery before were getting more and more spots popping up, and this was definitely affecting her. And she was very happy about COVID because she told me, Dr. Eson, I can put on a mask now. And that really upset me. And ultimately, uh, I had a long talk with her, and I spoke with her about uh, a treatment that's basically is called the Hedgehog-pathway inhibitor, and many basal cell cancers are driven by this pathway, and it's the pathway that causes this cancer practically. And by using these medicines such as hedgehog inhibitors. One of them is called Vismodegib. You'll have the spelling in the notes I'm going to write for you. And the other one is called Sonidegib. They're both available. They're pills. They're very decent in the sense that for advanced basal cell carcinoma, then curative surgery or radiation is no longer appropriate. So I went ahead and offered these to her, and I think it has really made a difference for her. The pills do not automatically mean that everything is easy and you're never going to have cancer again. She had complained to me a little bit of muscle cramps. She told me that food didn't taste as good as before. She complained of a little bit of a hair loss, occasional nausea, but I really didn't know how much of it was pill related and how much of it was the anxiety and the depression that she had gone through. But I blamed it all on the pill, and I tried to work with her as best as I could. What I told her was, luckily we have two pills. If one of them doesn't work, we can always try immunotherapy. One of the immunotherapy drugs that I've had a lot of success with is called semipilimab, and it's actually an IV, and it's not chemotherapy, it's immune therapy, and it really has been a godsend in the sense that it basically points out to your own immune system where the cancer cells are, and your cancer cells get attacked by your own immune system, such as squamous cell carcinoma, and we've had a lot of success with that. What I always think about is squamous cell carcinoma. These are more of a scaly, rough, crusted skin cancers. Many of them, again, are cured with surgery. Some of them are more aggressive than others. They can grow around the nerves, and they can go deeper than basal cell carcinoma. And because of that reason, it would be very reasonable to use immune therapy, such as ipilimumab or Keytruda pembrolizumab, which are all medications that awaken your immune system to fight these cancers. So bottom line is, for basal cell carcinoma, we have pills. For squamous cell carcinoma, we have immune therapy. And if you're at a point in life where you really cannot have anything else, please talk to your doctor, talk to your oncologist, and ask your dermatologist to refer you to an oncologist. Maybe we can help you so you don't end up going through all the struggles we already talked about. And ultimately, keep in mind, if you have basal cell carcinoma and the pills don't work, we can always do immune therapy. And they're kind of knowing that there are other options rather than getting cuts on your face. I really think it's a important issue to consider. Immune therapy has side effects as well, but it's definitely worth considering if you think you're at a point of losing your ear or losing your nose, or you're just so scarred up that you don't take off your mask anymore. So it's definitely worth talking to your dermatologist or your surgeon that does the Mohs surgery for you. In a nutshell, ask your surgeon, can we operate? And if the answer is, it is affecting you physically and emotionally, then maybe it's time to see an oncologist or a radiation oncologist to help you out. The reason I did this video was basically to give you hope, tell you that there are other options, number one. Number two, I'll put all this information after this video in writing because some of the wording is difficult. And I have now a dozen patients that I've treated for basal cell carcinoma in the last year and squamous cell carcinoma, and they've done great. And I look forward to seeing them hopefully within a month. And if you're not my patient, that means you haven't needed me or someone like me, so I'm very happy for you. But really, don't have fear about asking for different treatments. You don't have to go through multitude of surgeries before you make that decision. I wish you the best of luck, and I hope that the additional information I'll add to this video is going to help you.